I need to move on because I've got a member of Congress who has been waiting very patiently throughout this entire thing. Republican Congressman Mark Amodei of Nevada, who's been a friend of this show. Good to see you, Congressman.
Good to see you, Ali.
First of all, I have to correct something. Sarah Huckabee Sanders was not watching my show before she started this thing. There is no circumstance. I'm going to ask my control room if they can just show you this particular screen. Under Obamacare, by the year 2026, which the CBO looks at, they go out that far. Obamacare that year was going to go up 5.5%. BCRA, which is the Senate bill, indicates that it would go up by 4.4% a year. Congressman, I think you understand this very well. Under no forecast anywhere are insurance premiums going down. They might just go up by less, but they haven't gone down ever.
Well, that's an accurate statement of the reality, which kind of underlies the real fact that people ought to be talking about at least a little bit, Ali, which is if somebody thinks there's a sweet spot in health care in the near future, I'd sure like him to show us all where it is, because there isn't one. It's going to be a long, tough slog to get out of this.
Which is why I don't understand what this hurry is. Why does July 4th matter, or July 4th weekend? This is a really, really complicated matter. I mean, I spent 4 hours studying this thing after the CBO score came out, and this is the world in which I live. I mean, this is complicated stuff.
Well, it is, and I learned from when we went through it over here when people say, did you read the bill? Yeah, but the question you ought to ask is, how many times did it take you to read it before you understood? Because it is an absolutely phenomenally complex subject, and it is important that this initial start get it as right as much as possible. But, Ali, if anybody thinks there's going to be perfection out of any plan in the initial stages of this, it's like, well, good luck. I sure hope you're right.
So
but the history isn't there.
Congressman, you're pretty active, as I am, on social media. So whenever you come on the show, I hear from a lot of your folks. You also come from a state that is a Medicaid expansion state. You've got a senator who has said he can't really support this, and he thinks that his constituents won't support it. When I last talked to you, you were on the fence about the House bill. You did end up voting in favor of it.
Well, and you know, that was because we went and did a deep dive on Medicaid expansion. And those are important words, Ali, because everybody talks about Medicaid without differentiating between traditional Medicaid and expansion. Right. And the House bill on expansion basically said, if you're on it, you can stay on it until you're 65 unless you earn over 138% or unless you take employer's insurance. Now, you had mentioned earlier, Ali, that when you talk about the CBO, they need to put their head on a swivel and look at 60 degrees. In Nevada, one of the things that Governor Sandoval rightfully takes credit for is that unemployment is dropping. In Nevada, over half the people get their insurance through private plans.
Right.
So it is reasonable to hope that as that unemployment picture continues to develop over the next few years, and hopefully doesn't reverse, that more people are going to be joining that group and therefore not need the safety net, which when you differentiate between traditional Medicaid and expansion in Nevada, the expansion folks are somewhere in single digits. All of Medicaid is about 13% in Nevada.
Yeah, these distinctions are important because most people in America get their insurance through their work. And those people who go on these exchanges, which your party's been carrying on about how they're imploding and they're death spiraling and all that kind of stuff, that's 10 or 11 million people. There's 70 million people on Medicaid.
Which, Ali, gets to the important, I think one of the most important points that nobody on either end of the building is talking about. Hey, Mitch and Paul, when are we going to have the hearings on cost? When are we going to have those nice folks in those health insurance companies whose stocks have doubled in recent times and whose profits look pretty good over the last 8 years, and those pharma folks? Now, I'm a Republican, Ali. It's okay to make money, but when we talk about cost, we need to talk to those folks and, quite frankly, get them on the record.
So, Congressman, what we have is a process problem to a large degree. We are not getting the Democrats liked Obamacare. Some of them admit there are problems with it. Some resist and don't want to admit there are problems with it. Republicans seem to hate Obamacare, and nobody's working with anybody on this. Now, I have continually, day after day, tried to get pairs of you from Congress, and I've succeeded. I had one pair today, I had one last week, probably going to have another one tomorrow. At some point, this would just be a better outcome if Republicans and Democrats worked on it together.
You know, I got nothing to say to that except you're absolutely right. I wonder when we're going to put the issue ahead of the politics, because as long as uber politicized, we should all be fired.
Why is your situation different from Senator Heller's when it comes to him thinking that this bill is not good for the people of Nevada, and you thinking the House bill, which is not terribly dissimilar, was okay for people of Nevada?
Well, I'll tell you what, I suspect that Dean will have a chance now. I mean, I came out initially and said, I'm not putting my state in debt and I'm not kicking expansion people off of health care. And so we went through the process to make sure that those things weren't going to happen to the expansion population in Nevada. In Dean's defense, he didn't get to see much of it beforehand. So I'm assuming that he's going through the traps now, seeing how it actually works. I talked with Secretary Price this morning, who said he was talking to Governor Sanders. So, you know, I suspect that if the majority leader over there thought they were going to vote by this week, it's like that would be phenomenally optimistic. More time, I think, is good, especially when you haven't had the transparency of committee hearings.
Congressman, good to talk to you as always. Thanks very much for joining me again.
Thanks again. We'll see you, Ali.
All right.